Hello and welcome to Clinical Liver Diseases video series. CLD is an official digital learning publication of the AASLD. My name is Vinay Sundaram and I'm a hepatologist at Cedars-Sinai Medical Center. I'm here to interview Dr. Sobia Laique, who is a gastroenterology and transplant hepatology fellow at the Cleveland Clinic. She will be discussing her article entitled Surgical Considerations for Patients Transplanted with Acute-on-Chronic Liver Failure. Dr. Laique, thank you very much for joining us. How are you doing today?
Good, and thank you for having me.
Very good. So patients with acute-on-chronic liver failure, and especially with grade 3 acute-on-chronic liver failure, have a very high short-term mortality as well as high mortality on the waiting list. And unfortunately, though, they may also have high mortality after transplantation. So what is your opinion on the survival benefit in transplanting patients, particularly with grade 3 ACLF? And what's your opinion on when the optimal timing is to do so?
So thank you, Dr. Sundaram, for that question. And it's actually it's an excellent question, particularly in light of the fact that we have finite organs. So it becomes all the more important to judicially select how we choose our transplant recipients, particularly in patients with ACLF3, who, as you mentioned appropriately, have a very high short-term mortality rate and on the wait list. So recent data has actually shown that these patients definitely have a survival benefit when they're transplanted, and it ranges from as high as 80 to 90% in patients with ACLF1. However, it does drop down to about 50% or even lower in patients with ACLF3. But there's definitely an advantage to transplanting them. And so the question becomes, how do we judicially select patients with ACLF3 and ensure that they have the best post-transplant outcome? And that's really what our article is about, where we sort of take a deep dive into recognizing and identifying risk factors that predict a higher post-transplant mortality, and how do we preoperatively optimize these patients so that they have the best possible outcome.
Okay. Are there any validated scoring systems for risk stratification and determination of utility when transplanting these patients based on pre-transplant factors?
So absolutely there are. And in fact, there was a study by the group with Arzner et al., and they developed and externally validated the DAM3 score, which essentially looks at patients who are transplanted for ACLF3. And they identified 4 risk factors in terms of age greater than 53, an arterial lactate of greater than 4, a white count of greater than 10, and then whether or not these patients were on a ventilator and had a PaO2 and FiO2 ratio greater than 200. And each of these risk factors was assigned a score of 1, and a total score of greater than 2 predicted a significantly higher mortality if these patients were transplanted, with upwards of 80% being quoted in the study.
Okay. And I think you mean a PaO2 FiO2 ratio of less than 200.
I apologize. Yes, less than.
Okay. So the TAM3 score is one of the means for which we can stratify patients at high risk for mortality after transplantation. One of the things that's also interesting is that the TAM score is more specific to ACLF3, and but if you improve the patient to ACLF grade 2, then that will likely improve the post-transplant mortality. Of course, doing so requires management of organ failures. And do you have any tips on management of specific organ failures? So
again, a very excellent question. And I think that's really what our paper takes a deep dive into again, is specifically identifying which organ failures carry the highest mortality, and then how do you manage that in an intensive care setting. And so managing those in an ACLF patient is no different than any other patients with decompensated liver disease. So whether that's looking at patients who have respiratory failure, how do we optimize their ventilator settings in terms of the PEEP values and FiO2 to maintain? And then patients who have circulatory dysfunction, how do we, again, put them on the optimal kind of vasopressors? In patients who have renal dysfunction, how do we preoperatively do renal replacement therapy? And then similarly, addressing coagulation failure and then brain failure as well.
Okay. And which organ failures do you believe have the strongest impact on post-transplant mortality?
So most of the studies that have been done in terms of identifying these risk factors have definitely shown that preoperatively being on mechanical ventilation for greater than 48 hours and then requiring renal replacement therapy pre-transplant or going into transplant tend to have the highest risk for determining their post-transplant mortality.
Okay. And what's interesting about your article is that there is very little data or even discussion on surgical considerations in transplanting this population. So I'd like to end with what are the surgical considerations that we should all be thinking about in this population undergoing transplant?
So as we know, the surgical technique for liver transplantation has definitely evolved over the years as more data comes to light and our surgeons become more experienced in this. And I think one of the biggest changes that's happened is that most centers now prefer or opt to do the piggyback technique, whereby you're really trying to avoid having to put the patients on veno-venous bypass, since that has upwards of 10 to 30% complication rates. And when it comes to patients with ACLF3, I think one of the biggest considerations you have to make is that these patients come in with severe coagulopathy, thus increasing their risk significantly of intraoperative bleeding and leading to hemodynamic instability. So even though there is a preference now to opt to do the piggyback technique, if these patients have significant intra-op bleeding leading to hemodynamic instability, then absolutely veno-veno bypass needs to be considered.
Okay, thank you very much. Well, that was a very interesting interview. And again, thank you for your nice article. And thank you for participating in this video for another installment of the Clinical Liver Disease video series. And to our audience, thank you for joining us. On behalf of all of us from the CLD team, I hope you found this video useful and educational. For more information about this topic of acute-on-chronic liver failure and transplantation for patients with acute-on-chronic liver failure, please visit us at www.cldlearning.com. And thank you again for watching.